health context, we cannot achieve high outcomes, good indicators in health sector without investing in economic development, without investing in education, and the most important, in my opinion, is the political governance of the country. Unless or until we have honest leadership, unless or until we have political commitment, either we sign the signatory, either we ratify the conventions, we are not able to deliver. So it is very important to invest in political maturity, internal governance of the country, and sustained economic growth.
I would like to see some sort of overarching goal where we are focusing on the impact we would like to see, not just in terms of children and women surviving, which is important, but also ensuring that people can live healthier lives. In order to get there, I think one of the key lessons is that we need to have a stronger focus on equity and on integration. And I think the whole concept around universal health coverage provides us with a good mean to achieve that end goal of more healthy lives. Universal health coverage is both addressing the issues of equity, but also allow us for a more integrated approach, allowing countries to respond to their very specific health needs.
Civil society is very key because in the past there have not been a lot of engagement of civil society, but now I think it's time to actively engage civil society, to hold them, to show us evidence of what they are doing, what they have done for the past 15 years. I am looking at active involvement of communities. They are the people we are talking for. They are the people who are the beneficiaries of all the MDGs. And there has been very limited engagement of communities.
I think one of the big problems with the MDGs is the way that they just floated separate from any legal or accountability processes. We've already got human rights commitments. There's various conventions that people have signed up to, and there's laws in many countries that let people hold their governments to account for delivery on them. So why have the MDGs, or anything that replaces them, totally separate to that? And the other bit that I really want to see is universal health coverage. I think the idea that governments accept that it's their duty to make sure that everybody in their country has access to essential health care, and they shouldn't have to have the cash in their pockets to be able to pay for it, is fantastic.
He said it, but how many people in our communities, in our parts of the world, have even heard of the MDGs? We are coming to an end, so our vision is that the only way that our people can really benefit from whatever interventions they bring post-MDG must have the community at the center. Let's make sure it comes into reality, because it's only when the North and the South really link up in understanding the challenges that smaller organizations that wants to see this vision of empowering communities is taken seriously. That is when we can say that the post-MDG, the health of the people, ownership of the health of the people, will become a reality.